Good evening, I am Dr. Akl. I am a radiation oncologist in Flint. Today's topic, oral and oropharyngeal cancer. Oral and oropharyngeal cancer is related to smoking and drinking. We see such cancer in those patients who smoke, especially if they have long history of heavy smoking and alcohol abuse. Oral cavity include the oral tongue, the floor of the mouth, the buccal mucosa, the hard palate, and oropharynx is the back of the mouth, which will include base of the tongue, tonsillar fossa, the anterior and posterior pillar, the retromolar trigone, and the soft palate. Cancer of this area related to smoking and drinking. Diagnosed by patient history, those patients usually come with a lesion in the mouth or bleeding per mouth or pain. They seen by their family doctor, they see the lesion, they send them to ear, nose, throat specialist who biopsy such lesion and came up with the diagnosis of cancer. Many of these lesions are treated with either surgery or radiation. Tongue cancer classified to the anterior 2/3 of the tongue and posterior 1/3 of the tongue or base of the tongue. The anterior 2/3 of the tongue commonly treated with excision, and patient, if the lesion is small, they lose part of the function of the tongue. An alternative treatment to the oral tongue cancer who are treated with surgery, an alternative to surgical treatment is the radiation treatment by external beam or interstitial brachytherapy, where they put tubes into the cancer and the radioactive source travel in those tubes that lead to destruction of the cancer. Then the tubes are removed. Oral cavity cancer, including tongue, oral tongue, the floor of the mouth, buccal mucosa, hard palate, and gingiva. Those lesions, if they are small, they could be excised or treated with radiation. Results are equal. Early lesions, excellent chance of cure. You're talking about in the 90% plus. Advanced lesion would be treated with either combined chemotherapy and radiation. Radiation is the principal treatment. Chemotherapy add to effectiveness of radiation. For early lesion, chemotherapy is not needed, but for advanced lesion, it enhances the effectiveness of radiation. Based on national and international studies and trials, and many publications as well. Oral cavity cancer, when patients are treated with radiation, there is certain precautions of looking at the status of the teeth. Those patients who have very bad teeth, they need to be extracted when they are decayed and have poor function. However, those patients with reasonably good teeth, we advise them to use fluoride treatment to keep the integrity of their teeth. Those happen prior to radiation treatment. Radiation is highly effective in curing those lesions, and again, the main advantage of radiation in treatment of tongue cancer is preservation of the function of the tongue without compromise of cure. The oropharyngeal areas, including the base of the tongue, those lesions are treated with radiation with excellent cosmetic results. If they are early, they are treated with radiation alone. If they are advanced, they are treated with combination of radiation and chemotherapy. lesions in the oropharynx, including base of the tongue, tonsillar fossa, soft palate, and retromolar trigone. That's close to the tonsillar fossa. Is the name of the areas basically in the oropharyngeal area. Those lesions highly curable with radiation without compromise of cure. In the old days, the salivary gland used to be irradiated. Today, we have advanced technology to preserve salivary gland through what we call it intensity modulation radiation, and the salivary glands, mainly the parotid gland anterior to the ear, and the submandibular gland and sublingual glands. The main bulk of saliva come from the parotid and submandibular glands. Those easily preserved, factored out from the radiation fields because of the new technology. You could actually treat the area you desire to treat and stop or factor out the area you are not desired to treat. And I have been telling everyone, if we have a spider, you know the spider with long legs, you could treat the legs of the spider with radiation and spare in between. Today's technology is amazing and advanced to the degree we pinpoint our radiation to even very small area. Same token, we spare areas we need even if they are very small and close to tumor. So with advanced technology, we could target tumor very well, meaning give cancer good dose of radiation, spare normal tissue like salivary gland. We like to spare salivary gland because those are important to keep the saliva, which will keep healthy teeth and help patient swallow, and also fight against infection and so on. So the saliva is very important. In today's technology, we could spare the salivary gland, especially if the cancer further away from them and in early stage. Sparing salivary gland is easy in today's radiation oncology practice because of advanced technology. And sparing the normal tissue function more than ever before, increasing the dose to tumor, we actually get way better results. Oropharyngeal cancer and oral cavity cancer related to smoking and drinking. So for those patients need to stop smoking and drinking, that would prevent big number of such cancers. Those patients who had one cancer and if they continue to smoke and drink, there is a good chance of getting a second cancer, also chance of getting cancer in the lungs. So stop smoking and drinking is an important component in management of oral and oropharyngeal cancer. Oral and oropharyngeal cancer, alternative to surgical treatment is radiation treatment. Excellent chance of cure without compromise of cure. For the patients, need to talk to their surgeon about exploring such option.